fun to talk about these patches, and we've got several videos. We want you to back up and start with the first one as we tell you a little bit more about how the patches work. And today we're going to tell you a little bit more about some individual patches and how to place them on your body for the most effectiveness. And again, I'm a physician, but I'm not giving any treatment or advice or diagnoses. I'm just sharing with you some personal experiences and then some of the studies and research that has been done on the patch. So today I want to show you these two. The first one I'm going to talk about is glutathione. And then after that, I'm going to talk about carnosine. And you can see there in a little sleeve, I actually have a basket where I put my patches together like this. And the sleeve is a little envelope. You open it up like this. I'll start with the glutathione. And there are 30 little patches in there. They look like little Band-Aids. Little organic material in here. Organic meaning like crystals, salts, sugars, so on. And they're light activated. So listen to the earlier ones to learn about that. But glutathione is one of my favorite ones. I think that's patch and carnosine both should be paired with the X39 and the X49 patches. You'll need to go to another video to read it, to hear about those. But the glutathione, again, has no glutathione in it. No drugs, no chemicals, no medicines in any of these patches. They're light activated. So when you put them on your body, and I have the glutathione patch, there it is, on today. And you put the glutathione patch on several different spots in your body, and it's one of the best antioxidant detoxers, all right? So what I mean by that is it activates your body to pull out all the junk and the gunk that we get through foods and air and water and just, general pollution, molds, mildew, whatever. It helps to pull that out of the body. And you've probably heard of glutathione supplements and sometimes even glutathione IV pushes. Glutathione is very popular, but sometimes it's hard for people to tolerate when you're bringing glutathione in. This patch just simply asks your body in a gentle way by putting it here or some of the other places you can put it. It just asks your body to produce its own glutathione. It stimulates your glutathione patch. And for me, I've never been able to take glutathione really much at all because it would make me very weak. And this patch allowed me to gradually to increase my own glutathione production that I know genetically doesn't work optimally. And now I'm able to use that in detox every day. What's so interesting about the glutathione patch is that you don't have to use it every day to detox. You can do it a couple of times a week, 3 times a week, maybe. And the glutathione patch is especially important to wear as long as you're tolerating it initially. So you can wear it an hour, 2 hours. That's all for that day. That's okay. And we'll tell you maybe in another video how you can continue to use it because the patches last up to 12 hours. But the glutathione patch then can be used in your body. And over that period of 24 hours, we produce about a 300% increase in glutathione. And so that's why it doesn't have to necessarily be used every day, but you're going to produce more of your own glutathione in the right way. And it's something I can tolerate even when I wasn't able to tolerate the glutathione supplements. The patch that sort of pairs with it, so if you use glutathione 2 or 3 times a week, use carnosine 2 to 3 times a week. And carnosine is a cardiac, it's a cognitive patch, so your heart, your brain, and it also helps with tissue repair. And remember, when you get your patches, you're going to get a little booklet with them. And that little booklet will have pictures in it of places where you can find to put the patch. So for carnosine, for example, I'm going to get the little booklet here and show you. So you open up your little booklet and they'll have a picture here of someone, and you can see there's several different places. These are acupressure points in the body. So you can put it right in the middle of your chest, on the back of your neck, on your hand. in the back, low back, and at the wrist. These are just some recommended places, and you can find all of those spots plus more on the Lifewave website. You go to the individual patch, scroll down to the bottom, look at usage, and you'll be able to find many wonderful places to put it. So I alternate glutathione and I alternate carnosine, and I think that they, coupled with X39 and 49 patches, the Eon we've talked about before, are very amazing patches, and I encourage you to try them out and see what you think.